You had COVID, maybe mildly. Maybe you never even went to the hospital. A few weeks passed, and it seemed like it was all behind you. But then something went wrong. Exhaustion that doesn't go away after sleep. A fog in your head where you can't focus on the simplest task. Shortness of breath climbing a single flight of stairs. A racing heartbeat for no apparent reason. Joint pain. The loss of smell that simply never came back. And the most frightening part, doctors shrug their shoulders. Blood tests are normal, scans are clear. You're just tired, or it's anxiety. You hear it again and again. If this sounds familiar, this is for you, because what you are experiencing has a name, has a biological explanation, and science is finally beginning to provide answers. I research scientific studies and translate them into human language, without medical jargon, without panic, and without advertising. Today we are talking about long COVID, a condition that, by various estimates, affects up to 400 million people worldwide. To begin with, let's sort out the terminology, because even this causes confusion. Long COVID, also known as post-COVID syndrome, or post-acute sequelae of SARS-CoV-2, is a chronic condition in which symptoms persist or appear at least 3 months after the initial SARS-CoV-2 infection. Importantly, this does not mean the person was severely ill. Research shows that long COVID develops even in people who had a mild case, and even in those who notice no symptoms of the acute illness at all. What do the numbers say? A study from Mass General Brigham, published in the journal Nature Communications in 2025, tracked more than 3,500 patients. The result, 10.3% of them still had long COVID symptoms 3 months after infection. And here is what is truly alarming. 81% of those people continue to experience symptoms a full year later. This is not a rare phenomenon. This is a mass medical reality that has literally changed the lives of tens of millions of people, and which the medical community took far too long to take seriously. But in 2025 and 2026, the situation has begun to shift, and here is why. Let's talk about symptoms, because long COVID is treacherous, precisely because of its unpredictability. It looks different in different people, and that is exactly why it was so difficult to define for so long. According to data from the Mayo Clinic and large international studies, the most common symptoms include fatigue that does not resolve with rest, experienced by more than 70% of patients, so-called brain fog, difficulty concentrating, memory problems, struggling to find words, shortness of breath, even with minimal physical exertion, joint and muscle pain, a racing heartbeat, sleep disturbances, and loss or alteration of taste and smell. But there are also less obvious symptoms that are discussed far less frequently. Postural orthostatic tachycardia syndrome, and a condition where the heart rate spikes sharply when moving from lying down to standing up. Post-exertional malaise, where any physical or mental activity triggers a sharp worsening of symptoms the following day. Digestive disturbances, skin reactions, hormonal disruptions. A study from Northwestern University, published in the journal Frontiers in Human Neuroscience in 2026, analyzed patients from 4 countries. The conclusion: neurological symptoms, brain fog, fatigue, muscle pain, dizziness, and sleep disturbances were documented in every single country that participated in the study. And here is something critically important to understand. long COVID is not one disease. It is most likely several different conditions with similar symptoms but different biological causes. This is precisely why a single treatment does not work for everyone. And now, the most compelling part, what science has finally begun to understand about what is happening inside the body in long COVID. And these discoveries are changing everything. Until recently, many patients with long COVID were essentially sent home with a diagnosis of anxiety or depression because there were no objective markers in their blood tests. This was a medical failure because we now know long COVID is a biological condition with measurable physiological changes. Discovery 1: brain inflammation. A study published in Nature Neuroscience in 2025 showed that COVID-19 causes dysfunction in microglia, the immune cells of the brain. These cells begin damaging neural tissue, triggering neuroinflammation that continues long after the virus itself has disappeared. This explains brain fog. It is not all in your head in the figurative sense. These are literally measurable changes in the brain. Discovery 2: the immune cell, LCMO. In March 2026, scientists from the Helmholtz Center published a study in Nature Immunology in which they identified a specific molecular state of immune cells called CD14 plus monocytes. These cells, which they named LC-MO, were found in long COVID patients and directly correlated with the severity of fatigue and respiratory symptoms. This is one of the first concrete biological markers of long COVID. Discovery 3: autoantibodies. A study published in Cell Reports Medicine in March 2026 by a team from Dutch universities showed that the immune systems of some long COVID patients produce autoantibodies, antibodies that attack the body's own tissues. When these autoantibodies were injected into mice, the animals developed persistent pain like hypersensitivity. The effect was reproduced even by antibodies taken from the same patients 2 years after their initial infection. Discovery 4: microclots. Researchers from South Africa found microscopic fibrin clots in the blood of long COVID patients, abnormal protein structures that do not dissolve the way they should. These microclots may disrupt microcirculation in small blood vessels, explaining fatigue, brain fog, and other symptoms. Discovery 5: brain fog as a biological phenomenon. Japanese scientists from Yokohama City University in 2025 used cutting-edge PET scanning technology to directly visualize changes in the living brain in long COVID for the first time. They discovered a widespread increase in AMPA receptor density throughout the brains of affected patients, linked to cognitive impairment and inflammation. This is the first direct evidence that brain fog is a measurable biological condition, not a psychological problem. Now let's talk about what many people want to know most. Is this permanent? The Mass General Brigham study identified 8 different trajectories of long COVID. And this is good news because they are genuinely different. Approximately 60% of long COVID patients experience slow but steady improvement over 12 to 24 months. Their bodies gradually recover. But there are other trajectories too, with persistently severe symptoms, with a wave-like pattern, with symptoms that only emerge 15 months after infection. For some patients, long COVID becomes a chronic condition lasting for years, what increases the risk of a severe course. According to the same study, women and people who are hospitalized with acute COVID have a higher risk of persistent severe symptoms. Also at higher risk are people with diabetes, cardiovascular disease, and autoimmune conditions. And one important point about reinfections. Data shows that each new COVID infection increases the risk of developing or worsening long COVID. This is not a reason for panic, but it is a reason to take your protection seriously. And now, what is actually being done? And what does the science show about treatment? The honest answer: there is currently no specific approved treatment for long COVID, but that does not mean nothing is happening. Quite the opposite. The United States National Institutes of Health launched the largest long COVID research program in the world, Recover, with a budget of $1.15 billion in 2025. Enrollment was completed for all 8 clinical trials, testing 13 different treatment approaches. In 2026, the first results are being published. What is being tested right now? Baricitinib, an anti-inflammatory drug originally created for rheumatoid arthritis. Low-dose naltrexone, an immune modulator showing promising results in autoimmune conditions. And yes, semaglutide, the very same Ozempic, is also being tested as a potential treatment for long COVID. Interesting, isn't it? From already published data, a Mass General Brigham study in 2025 showed that NAD+ supplementation demonstrated early promising results in reducing fatigue and brain fog in long COVID patients. NAD+ is a coenzyme critically important for cellular energy production. Its levels decline during chronic inflammation. As for lifestyle, data shows that long COVID patients should absolutely not do what seems logical: push through activity by force. Post-exertional malaise, one of the key symptoms, means that intense exercise can worsen the condition. Instead, gentle pace activity, quality sleep, stress management, and an anti-inflammatory diet are what leading clinics are now recommending. I want to finish this conversation with something important. Long COVID was invisible for too long because it was difficult to measure, so because the symptoms seemed vague and because many patients heard, "Everything looks normal." That was unfair, and it cost people their health, their work, and their quality of life. But now science is moving in the right direction. Biological markers have been found. Clinical trials are underway. Answers are emerging. If you or someone close to you is struggling with long COVID symptoms, know this: it is real. It is not in your head. It is a biological explanation, and you have the right to demand attention from specialists. I do not give medical advice. I research science and share what I find. If you suspect you have long COVID, talk to a doctor who is familiar with this topic. Ask for a referral to a post-COVID specialist. All the sources I used: Nature Immunology, Nature Communications, Nature Neuroscience, Cell Reports Medicine, Mass General Brigham, NIH Recover. I will list in the description below the video. Until next time, take care of yourself and do not ignore the signals your body is sending.